Well, welcome back, everyone, and welcome to those who are new to coming to this final session, session number 6 of Faith, Science, and Reason. But this time, I think, is one of, it's an important topic dealing with medicine and faith and how they relate together, and really might be the most personal one of all the different aspects, that it really comes down to really things that you may come across in our personal lives, and really hit at really the moral aspect of things as well. So we'll be dealing with how does the moral teachings of the church hold up when we view them in light of the medical science that we have today. So as we always do, we'll start with prayer, and we begin again using the method of Lectio Divina, using the gospel for this coming Sunday, and also the psalm. Unfortunately, it's not the psalm from this coming Sunday because I forgot to change it. So it's a psalm from, I think, the last one that we did still. So we begin by asking the Holy Spirit to enlighten us, to be able to listen to His Word. We read the passage, meditating upon what God's speaking to us through the passage, and then we spend some time listening to what it is that He's saying, and finally finish with praise. So let's ask the Holy Spirit for His assistance. Come, Holy Spirit, help us to see your presence during this glorious time of Easter, to recognize, like the disciples did, when you appeared to them. Though we may not see you right away, help us to be able to see you even though you remain hidden at times. A reading from the Holy Gospel according to John. On the evening of the first day of the week, when the doors were locked where the disciples were for fear of the Jews, Jesus came and stood in their midst and said to them, "Peace be with you." When he had said this, he showed them his hands and his side. The disciples rejoiced when they saw the Lord. Jesus said to them again, "Peace be with you. As the Father has sent me, so I send you." And when he had said this, he breathed on them and said to them, "Receive the Holy Spirit. Whose sins you forgive are forgiven them, and whose sins you retain are retained." Thomas, called Didymus, one of the 12, was not with them when Jesus came. So the other disciples said to him, "We have seen the Lord." But he said to them, "Unless I see the marks of the nails on his hands, and put my finger into the nail marks, and put my hand into his side, I will not believe." Now a week later his disciples were again inside, and Thomas was with them. Jesus came, although the doors were locked, and stood in their midst and said, "Peace be with you." Then he said to Thomas, "Put your finger here and see my hands, and bring your hand and put it into my side, and do not be unbelieving, but believe." Thomas answered and said to him, "My Lord and my God." Jesus said to him, "Have you come to believe because you have seen me? Blessed are those who have not seen and have believed." Now Jesus did many other signs in the presence of his disciples that are not written in this book, but these are written that you may come to believe that Jesus is the Messiah, the Son of God, and that through this belief you may have life in his name. We spend a moment reflecting on what has moved us in this scripture passage, how it is that God may be speaking to us through it. Comes to my mind is earlier today I was explaining this story to the kindergartners, and it's always fun explaining the scriptures to them and telling them about one of them. His name is Thomas, and so he was very excited to learn more about the Apostle Thomas. I think for us who've been attending some of these things and gleaning something of the truths of the church that teaches about how science and faith go together, We're in a sense called, like the disciples, to go forth and to help others see, others hear who have not been here to see, have not been here to hear, and help them also understand how faith and science work together. And spend a moment just listening to our Lord. Now I respond with the psalm. You can repeat the verses after me. I will walk before the Lord in the land of the living.
I will walk before the Lord in the land of the living.
I believed even when I said, I am greatly afflicted. Precious in the eyes of the Lord is the death of his faithful ones.
I will walk before the Lord in the land of the living.
O Lord, I am your servant. I am your servant, the son of your handmaid. You have loosened my bonds. To you will I offer sacrifice of thanksgiving, and I will call upon the name of the Lord.
I will walk before the Lord in the land of the living.
My vows to the Lord I will pay in the presence of all his people, in the courts of the house of the Lord, in your midst, O Jerusalem.
I will walk before the Lord in the land of the living.
All right, so today, like I mentioned, we'll be talking about faith and medicine, how they work together, dealing with science and how it deals with the moral teaching of the church. And just so I kind of know, how many people here work in any kind of medical background? All right, so we have a few of you. So have you ever come across things dealing with the morals of the church in your work? So I think probably, even those of us who may not work in that area, there's many important issues that come. And I myself am not in the medical area. In fact, when I was going to go to college and I was telling, I wanted to go into the sciences, and then the admissions people would respond, oh, you want to go into, you want to be pre-med. And I'm like, no, I don't want to do that part. So medicine wasn't necessarily my first interest or my first love, so I feel somewhat kind of inadequate in some areas in these. So I'm definitely not going to be able to cover things in that kind of great detail. But I hope to cover some certain specific cases that kind of push us into the that kind of tension that sometimes arises between our faith and what comes forth through scientific medicine. And really not so much focusing on specific, there will be specifics in the medicine, but putting it in that more general context of understanding how faith and science interact in the area of medicine and moral teaching. So there you may ask me questions that I do not know because I'm not in the medical field myself. So just letting you know that. So kind of as an introduction, medical science and faith really go together from the very outset because Jesus himself is the divine physician. He is the one who first heals. So when we get into healthcare, they have this special vocation that carries on something of the vocation that Christ himself brought, of bringing life, of bringing healing to others. So the people that work in those areas have a very important vocation that follows from the very vocation of Christ. So they're called to be this presence of Christ within that field, that vocation. So really, we want to have this fruitful dialogue between the medical sciences and the Christian faith, because the Christian faith helps us to widen our understanding of who the human person is. As we go through, we'll notice places in which, as we've talked in earlier ones, where science is limited. So it can tell us many great things about the human person and who we are, but it also needs faith to be able to elevate that, to be able to understand the deeper meaning of who we are, that we are also spiritual beings, not just physical. So I think that's really where our faith can help uplift the medical fields, is bringing that helping them understand the person as a whole. Those quotes come from the religious and ethical and religious directives that come from the United States Council of Catholic Bishops. So basically what I'm going to do tonight is I'm going to go through some of the Catholic moral principles of the Church, and then I'm going to apply them to some example cases. Because the moral principles are, of course, very important, but sometimes some of the principles are difficult to understand apart from the actual practical cases in which they are applied. For example, we'll talk about something that you may have heard before, double effect. I don't know if you've ever heard that term thrown around, but it's very difficult to understand apart from actually applying it to a specific case. So we'll apply that. That'll come up a little later. Two of the main things that I want to show is how good science today actually supports, in a sense, what the Church teaches about morality. That when the Church says this certain thing is immoral and this certain thing is moral, well, good science actually supports the fact, like when morals are upheld, the science is actually more fruitful than when the morals are not upheld. So, and there'll be some examples in which we'll bring that out. Also, we'll show how a lot of times the moral problems that arise come about when we overstep the bounds of science. So we try to do things either out of a knowledge that we don't fully have, or we think we've got to solve this problem at any cost, no matter or not whether we take a moral or an immoral route to it. So those are two main things that some of the cases that we cover later will kind of bring out. So before we do that, we have to go through the general principles that come from Catholic moral teaching. So these are really the four fundamental moral teachings, moral principles of the Church. First is God is the master of life. Second one, that man is a steward of that life that was given to him by God. The man is made in God's image and likeness, and that human life is fundamental but not an absolute good. So we'll go into each of these four in greater detail. First, God is the master of life. Does anybody here create themselves? Bring themselves into being? No, we can't do that. God's the only one who can bring things into existence out of nothing, bring life into being. We didn't determine when we came to exist. In the same way, we're not to determine in the way we cease to exist in this life. We don't have that control because it's been given to us by God. So there's a limit on what we can do as humans because we're not totally our own. We belong to God. A great example of this limit is right away from the beginning in Scripture. God puts the tree in the garden and tells Adam and Eve not to eat from the tree of knowledge and good and evil. So he's giving them a limit, saying, yes, you're good and I created you, but there's also limits because you didn't create yourself. I'm the one who brought you into existence. So God is the author of morality. So everything, all these principles of morality that we talk about are not things that, priests and bishops and the Pope, sat down together and, tried to figure out exactly, what are these rules that we should make everybody follow? Well, no, they were given to us by God. So he's the author of morality, not us. And as I mentioned already, that giving things life and giving things death belongs to God alone. And I mentioned that God, we don't create ourselves. But from the very beginning, God gave us, brought us into existence as a gift. And our life is a gift from God. So he's the master of life, but he does give us lots of freedom within this life that he gives us. It's not absolute, but he does give us, he does call us to use our life in a way that's in accordance with what he made us for. So man is a steward of his life. And you see that again in Genesis, where God tells Adam to go forth and name the animals. He has a certain dominion over the animals. And then he's also, Adam and Eve are told to go fill the earth and subdue it. So it's a call to use the gift of the life that's been given to them by God to really, in a sense, become what they're meant to become and to give glory to God in the process. So this autonomy or freedom that's given to man is something of the freedom out of which God created man. So we can see already that we share something of that, of who God is. And that leads us to this third one, that we're made in God's image and likeness. And that's really the foundation of our great dignity, is that compared with all other things that God created, we're the only one that he created in his image and likeness. Everything is, in a sense, made after God's image, since everything, in a sense, can point us back to God. But the human person, because we're not just matter, but we're also spiritual. We also have a spiritual soul. We can think and we have freedom. That is how we are in God's image and likeness. And not even when we sinned was that taken away. We may not image God as well anymore because when we sin, but something of that great dignity is never removed, even in the face of sin. And then the fourth one is that human life is a fundamental but not absolute. And that's a very important thing to remember, is that the gift of life that God gave to us is very good. That's what he said when he made man. Remember, he said, man is very good. But it's so good that we can't use other people for our own desires. But we have to treat them out of love. So we can't use them, but treat them out of love. But this human life that we've been given, even though it's a very great good, it's not the greatest good. So it's a good, so we have a duty to try to preserve our life, to take care of ourselves. But it's not absolute to be upheld above everything else, because eternal life is a greater good than the short time that we have here on earth. Doing good is a greater good than physical life. So if the choice is to lose our physical life or to lose our eternal life, that's what the saints did. They were willing to lose their physical life for the sake of being able to retain their eternal life. So that's an important principle to keep in mind, that even though our physical life is very, very important, it's a very important good, that there's something greater than that. All right. So those kind of things form kind of the background of this next section of trying to understand what we do, because that tells us a lot about who we are. But when it comes to morality and following God and living our daily life, we do a lot of things. We make decisions. We make choices. Did anybody make any decisions today? Any choices? Lots of them, right? We made lots of them. And so every time, some of the choices we almost make without thinking. But some we have to deliberately kind of choose between one thing or another. And so these we can call human acts, that when we freely make a choice between one thing or another. So that's a human act, freely chosen after we make a judgment about something being good or bad, good or evil. And so there's three things that come into play when we make any kind of choice like that. First, it's what's called the object. And so that's that thing that we choose. What are we going to choose to do? And I say on here it's the good act, because actually everything we choose because we at least think it's good. No one chooses to do something because they think it's going to be bad for them, that they think it's going to be evil. Maybe you know that, well, this could have bad effects later on, but you choose it for some kind of good. Maybe for what you're going to get right now, as opposed to the bad that might come from later. But we always choose to do something because it's good. But the thing is, it may not always really be good. So that's what the object is. It's the actual thing that you choose to do. Then there's the intention, which is kind of the reason for why you do that thing. And then finally the circumstances. So the whole kind of complex context in which you make that choice. And the things going on around you that have a tendency to affect how you make that choice. So those are the three things. So first, let's look at the object. So that was the actual action you're going to do, that you make a judgment of whether it's good or bad. So how do we do that? Well, we use our conscience, and our conscience, sometimes that word's thrown around a lot, and sometimes we get the idea that conscience is based some kind of, well, we just kind of, whatever I think is right, and then so that's how I follow my conscience. If I think it's okay, then it's fine. But that's really not what our conscience is all about. What our conscience does is it takes two things and compares them. It takes God's divine law, which is the truth that he gives to us about the way the world is. Remember, we don't determine that. It was God who made everything, so he determines that. And there's two ways of looking at it. God's divine law, and then it's also given to us through, so like his divine law could be through either like his spoken word that we receive through scriptures, like the Ten Commandments, or it could also be through the law of the way we observe the world to be. That there's certain things act in certain ways. So we discover what the law is, and we compare it to the action that we're going to do. And when we do that, we have an understanding or perception of those laws, and an understanding and perception of the act. And so we take those two and we compare them. And then we have to decide how they compare with each other. So if the action follows God's law, then we judge that the conscience judges that it is good, that the action is good. Now when you compare the action and God's law and you find out that they don't go together, then you discover that the action is evil. So that's what conscience is all about. It's all about knowing God's law, his divine law, that he reveals to us through Scripture, through the natural world, through the teachings of the church. We understand his law, and then we compare it with the action that we're contemplating doing, and we decide whether it's good or bad. So that's how we determine the action to do, or the object. And then we have the intention. So the intention is the reason for why you're doing it. We all have intentions for why we do things. A lot of times we don't have just one. We have multiple ones that we deal with. But the intention that we have could be either good or bad. Just like the action itself could be good or bad. We could want to do something good, like give money to the poor, but we could do it for a bad intention. We could do it because we want to be seen as, this great philanthropist or something. So just because we have... So that actually is the... Let's see. A bad intention. A bad intention can't make a good action, or will make a good action bad. Vice versa, if you have a good intention, it can't make a bad action good. So, if you're going to kill somebody for some reason to prevent them from killing somebody else, well, that's not you can't do that bad action just because you intend to do a good thing. So, a good intention can't make a bad action good, and a bad intention can make a good action bad. So that's how intention fits in. And also, just because you intend a good end, it doesn't justify using an evil means to get to that good end. So, in order for it to be a good action, both the object and the intention have to be good. Both of them have to be good. And then finally, the last one is circumstance. And I think most often this is the one in which, people try to say, well, the actual thing might be bad, but because of the circumstances, I think it might be okay. Well, that's actually faulty reasoning, because a circumstance comes secondarily once an act has been determined. Circumstances can increase or decrease the level of something being good or bad, but it can never change it. So, for example, murder is always bad. It's always an evil act. But, for example, killing someone in self-defense can remove some of the moral culpability from a person, but it doesn't change the fact that killing another person is a bad thing. So circumstances themselves can't change the morality of an action. So they can't make a bad act good, and they can't make a good act bad. All right. Every time you do something, you've got something that you intend to do. But a lot of times, there's more than one consequence that comes out of it. And sometimes there are things that come out of it that we don't mean to come out of it, that we don't intend. But maybe sometimes we even see that they're going to be there ahead of time. Well, that's when the principle of double effect comes into play. And I'm going to kind of go through just the principles of it, and it may not make total sense. It may be kind of theoretical to you right now, but we'll eventually get to a case in which it'll become more concrete. So, this basically comes into effect, or comes into use, or when there's at least two effects. One that was called the direct effect, the one that is intended to do, and then the one that's indirect, which is something that's evil, and you see it ahead of time, but you don't intend it. But you permit it so that this other good can come out of it. So, an action which is good in itself, which has two effects. The direct effect that you intend is something good, and the indirect one comes about because of it, but you don't intend it at all. And there has to be what's called a just order between the two. And I have to explain what that means. Just order between the two. So there has to be, the good that you intend has to be a significant good compared to the evil. You can't intend, something good that, is not as significant a good as the evil that causes. If it's the evil that it causes is much greater in a sense than the good that it brings about, well then you cannot apply this. And sometimes it's difficult to be able to tell just exactly if you have a just order. So sometimes it comes down to a prudent judgment that you make based upon the laws that you know given to you by God and what the action is through the conscience. So there's actually 5 criteria that have to be met in order for it to work. That the action has to be good, or at least indifferent. So it can't be a bad action that you're doing. That the good effect can't be obtained in any other way. So if there's a way to obtain that good through a way in which wouldn't cause that other evil thing to happen, well then you can't use that action that would cause the evil thing. And then third, you can never will that evil action. If your desire was to bring about the evil end, well then you can't apply double effect, and that would be it. You can't do that action. Then the fourth one, the evil effect can't be the means or the way in which you get to the good end. So it can't be. It'll become more clear in this situation. It's much easier when you have a specific case. So I don't want to spend too much time in explaining it with words, and I probably wouldn't do a very good job with it. And then finally there has to be that just order between the good and the evil that's permitted. So you'll probably forget about this by the time we get to it again, but you'll see it again later. So these are the example cases that we're going to go through. So this is the really interesting stuff. All that was kind of give us some of the background behind it. So you can see we're going to get into some nice topics here. So the first case is on condoms. So the question is, can condoms be distributed to those people with high risk for sexually transmitted infections? And I've actually had this asked of me since being a priest, like in a very practical situation, not just in theory, but in actual practice. So what is the Catholic teaching? Well, the Catholic teaching, as you probably know, is that it's always intrinsically wrong to use contraception, which includes the use of condoms. And here's a quote from Humana Vitae, which defines what an act of contraception is. That's an anticipation or accomplishment or during the process that proposes to render the procreation impossible. So that's the Catholic teaching. The condoms are not allowed to be used. So the issue then is, well, it seems that perhaps condoms might decrease the risk of the spread of disease. And so if it did that, wouldn't it be a charitable thing to allow to occur? So is the church being unreasonable in this, saying that contraception always is intrinsically evil? Would it not be charitable to allow some people to use it? So that's the question. Well, first let's look at the science behind this. So in the science, true, condoms could lower the risk of an individual act. That's something that's always, it could be failed to be used properly, but putting those things aside, it seems that, in an individual act it could reduce that. But science also shows us that in reality, the use of condoms supports a lifestyle that actually increases the risk. So even though an individual act might decrease it, what's discovered to happen is that it actually increases the risk within that population. And so this is Dr. Edward Green. At the time that he wrote this, he was at Harvard University. Not a Catholic, so this is not just something that Catholics have come up with. But for him, he discovered that condoms, in their use in Africa, have shown absolutely no results of preventing the spread of AIDS in Africa. And in fact, it does the opposite because it makes one feel safe from it, and so then they behave in riskier actions, like increasing the number of partners that they have. These are some quotes from him. I like the first one. When the ancient astronomer Ptolemy said the sun orbits the earth, he made one of the most notorious mistakes in scientific history, yet no one died from it. But when Westerners convinced Botswana that condoms would stop AIDS, the results were catastrophic. About 1 in 5 adults there now have HIV. So in fact, in Botswana, what happened when condoms were introduced, it actually increased the spread of AIDS. So the actual scientific observation of it showed there's something wrong there with that reasoning that it would be helpful. So why is that? Well, at first we could be, well, what are science's limitations in this case? Well, science, as we've said in previous ones, looks at the physical part of the person. So it only sees one aspect of who the person is. It doesn't address the person as a whole. It doesn't address their spiritual needs. And so in doing that, sometimes it looks to a kind of quick solution rather than attempting to change the person as a whole, to change their heart. And that kind of leads up into how Pope Benedict has responded to this. You may remember, a couple years ago now probably, when pretty much got into mainstream news that suddenly Pope Benedict has changed the church's teaching on contraception. It's okay to use condoms. You remember hearing about that? Yeah. So it was confusing. Okay, what exactly did the Pope say? So it was in an interview. So here's kind of what the question was that was asked. So it was told to the Pope, well, isn't it madness to forbid these high-risk populations to use condoms? And his response was that in certain cases it could be a sign of a first step in the direction of a moralization. In other words, it was the first step towards seeing that I need to pay attention to the results of my action. If my actions good or bad, my actions are good or bad. So I need to pay attention to that. So using a condom where previously it wasn't could be a sign in that person that they were actually beginning to think about what they were doing. But he continues on and says, but it is not really the way to deal with the evil of the HIV infection. So you can see already from there he's not really changing it. And so this question that was asked right after that helps clarify. Are you saying then the Catholic Church is actually not opposed in principle to the use of condoms? And so he responds, she of course does not regard it as a real moral solution, but as a first step in a movement toward a different way of living. So, yes, the Church is still opposed to condom use. So if you come across anybody who tries to tell you that Pope Benedict has changed that teaching, no, he hasn't. It's still the same. That's not the solution. Benedict's point is that the solution is conversion, not condoms. Of course, someone could then ask, well, wouldn't distributing condoms to people help with that conversion then? If you're saying that, and they could argue that, and like, no. In his example, it was the conversion that happened first, right? Someone wasn't using it, they started beginning to have a change of heart, and then they began using it. So the conversion began before that. So there's nothing intrinsic in using condoms that brings about conversion. So it doesn't automatically lead to conversion, but in fact, in most cases it becomes an obstacle to conversion, as it was shown by that empirical evidence of supporting, this lifestyle that makes them more at risk. So, conversion is the solution. It's not as easy as you could imagine. So is it possible to teach conversion? Yes. In fact, it's already being done in some places. For example, in Uganda, they have these behavior change programs that have already begun to be used. And there's a graph there. As you can see, the decrease in the percentages from 1990 to 2007 in HIV prevalence in adults in Uganda with the start of these behavioral change programs. There's scientific evidence that behavioral change programs work, whereas there is no scientific evidence that condom distribution works. So behavior change programs basically helps to teach people that there's something else, that you can abstain, that you can be faithful to one partner, that you don't have to follow the main prevalence of the culture around you.
Well,
And
who puts on those behavior change programs?
It's related closely to the Catholic Church. Here's some examples of. The program itself is called Education for Life, is the one that was going on in that case, and these are a couple of documentaries that you can actually watch the whole length of these documentaries online, and you can see really what is going on in the lives of these people. And to give you a kind of taste of that, we'll give you this clip, and instead of me talking about it, we'll let someone who actually lives in that experience talk about the difference between condom distribution and behavior change programs.
Yeah, to these big organizations like the United Nations, like countries like the United States and Britain, I would say that they should give people a chance because people have the inherent capacity to self-control. We are not like animals. We have that self-control within us.
It's really sad, and it's unfortunate why the world is misleading young people. For me, it saddens me so much. You see, we are living in a world whereby people have very many interests, and they think they are going to use young people to achieve their personal interests. Some, especially the promoters of the condoms, think that young people cannot control themselves. Maybe some people didn't have a chance to hear this message when they needed it, when they were young. And therefore they were not able to practice abstinence. Therefore, it came as a concept when they had already grown up. And maybe they tried it and it failed. And they think that since it failed with them, it will fail with everyone. But I'm a testimony myself. I finished my primary without having sex. I went for my secondary education, I didn't have sex. I went to the university. I was a laughing stock to some of my colleagues. I was not having sex until when I got married. I never fell sick because of not having sex. I abstained. Can this world tell me that it only worked with me? Can they say that? No. The way it worked with me, it can work with everyone else. Let us give young people a chance. My friends who used to laugh at me thinking that abstinence is abnormal, most of them are dead by now. And some of them, or I visit them, some of them are sick, they are on the bed and say, David, I wish we lived your path. I wish we abstained. If we were to live a new life again, now we know which works. So I'm 100% convicted and convinced. I speak out of experience and out of conviction that abstinence works. And it is the 100% strategy that we can use to overcome the HIV/AIDS pandemic.
All right, so there is an example of how science basically supports what the church has always taught in that area. That by remaining true to what the church teaches, we're actually following the greatest science and helping save lives. So, any questions on that?
I was going to say, just kind of point out that, I mean, psychological research and kind of basic human behavior points out all these things as well. I mean, the basic idea that you go out and buy a Prius and you feel good about yourself, that you're not polluting as much, and studies show that you drive more miles. So, this kind of, I mean, that's just how we react to change. And
All right. So our second case, we'll move on to a related one, continue in the contraception area, but this time we're going to look at it from the point of view that it's poor medicine. So in general, contraception is kind of unique in the medical practice because it's the only place in which something is used to treat, something normal is being treated, something normal and healthy is being treated as though it were a disease, as though it were not functioning properly. In fact, what's going on is that medicine is being used to treat a social problem, perhaps the social problem of having unwanted children or unwanted pregnancies, or the social desire to have sex on demand without any consequences. So contraception and even abortion, really, theoretically, they're not so much to treat a medical problem, but to treat a social issue. On the scientific end of it, there's basically three ways in which contraception works. The first one is to shut down ovulation. The second one is to prevent sperm by migrating by changing the cervical mucus. And then the third one, which is not often known or talked about, is that it changes the lining of the uterus so that if conception were to occur, implantation would be prevented. Which the result of that, of course, if conception occurs, that basically forces an abortion. Tons and tons of research has been done in the area of contraception. Very, very little has been done in the area of exactly how often that third one occurs. So I can't tell you exactly how often, but just the fact that it's a possibility should make us leery about that. And many women are not even told that that's a danger, that that's a possibility, a mechanism in the way that it works. They should be told because, I mean, they should know if they're taking some kind of chemical, some kind of medicine, how it actually affects them. Not going to read through all this, but these are some of the other things that contraceptions we're told that they do, that they can help. So they can they have other effects rather than just acting as preventing pregnancy. So these are kind of things that they're positive things that they're told that they do. Then these are the negative things, negative side effects that come across. So to me, I think this I didn't actually count it, but this list seems longer to me than the previous ones. That these are risks that can come out of, and these are oral contraceptions. Some of those specific ones. But really, the thing I want to focus on is how that when contraception is used for other things rather than contraception, that it's not really used in the way proper medicine should be done. And since I don't know a lot about this, we're going to use the words from Dr. Hilgers. We find he's the founder and director of the Pope Paul Institute, which is here in Omaha. And he's going to talk about how contraception is applied to other medical problems and conditions that women are facing, but they never really treat the underlying condition, and so that those problems still remain there. They're just hidden underneath, and it continues to expose them to those greater side effects.
Of course, now with the birth control pill, which complicated it is that all of a sudden they found that all these crazy things that happen to reproductive age women, like abnormal bleeding, irregular cycles, premenstrual syndrome, endometriosis, recurrent ovarian cysts, and the list literally goes on and on and on. They thought, oh, God, we can give them birth control pills now, and that treats them. But now we are 47 years into the birth control pill. There is not one disease that has been proven to be treated effectively by the oral contraceptive. Not one. Now, you could say that, well, what about acne? Because that's one that, in fact, one drug company got the bright idea that if I design the study right, we can actually get it passed through the Food and Drug Administration and list it on their list of accepted indicators for its use, acne. Well, they put some money into this. It's a very bright sort of marketing move on their part. They could show the FDA that it helped acne, and so then it turns out that the FDA approved it for that, and guess what? This oral contraceptive is now the number one selling and has been for at least 10 years because of that one thing. Now, does it treat acne? The answer is no, it doesn't treat acne. It suppresses it for a time while you're taking the birth control pill, and so in that sense it makes you believe that you're treating the acne. But you stop the birth control pill, it all comes back again for the most part. So, it's not treating any diseases. So we look at the medical evidence behind all of these things, and it doesn't exist. I'm in the process of preparing a talk, actually, that I'm going to be giving, and the title of it is Junk Science in Reproductive Medicine. And maybe at a later time, when we are talking about these issues, maybe on this program, we can talk about some of the junk science that's out there. It's incredible. It's just incredible what we've been selling people in this age today. Sort of evidence-based medicine, which is a big buzzword right now. They can claim all of these things that are usefully affected or treated by the birth control pill, and in fact there's no evidence at all that the birth control pill effectively treats it. No evidence.
Mm-hmm.
And yet that's what we're supposed to say there is. We've got to have evidence for everything. In fact, the evidence we have would suggest it doesn't work at all, and yet we still use it. And so now the women go not just for birth control, but they go because of this or that. I can't tell you the number of young girls, especially 18, 17 years of age, who get put on birth control pills. They go to their doctor. Mom takes her to the doctor, and she's, well, my cycles are kind of irregular. And the doctor says, oh, I can fix that. And he writes out a prescription for birth control pills. And then the doctor says, you take these and so forth. And so she goes home and starts taking them. All it does is it kind of regulates bleeding, making them think they're being treated, because now they have a regular bleeding episode every month. They don't have these long and irregular cycles anymore. But it doesn't treat the underlying problem. It doesn't get to the underlying problem. It doesn't even find out what the underlying problem is. And so this young woman is left with that underlying problem when she comes off the birth control pill, but however long she's been on it, she has to suffer through whatever side effects or long-term effects that this may have. But what's the doctor doing when he does this? I'm telling you, universally, he's thinking in the back of his mind, but he doesn't tell the patient, I'll just write out this prescription because you can not only regulate your cycles, but you won't get pregnant either. So I'm doing my duty.
Yeah, I'm actually doing you a favor.
Yeah, but he won't talk that way, or he or she. In fact, it's as prominent amongst obstetricians that are women as it is amongst men. They won't say, here's your birth control pill, and you can get regular cycles, and oh, by the way, you won't get pregnant. They don't say that, because they're kind of afraid to, because, gee, this young girl might say, but, I'm not sexually active. What do I do now? The doctor says. Then he would say, well, you probably will be. So she goes on, and she's on this birth control pill for really two reasons, but one is unstated, and the other isn't. And it makes it look like it's for medical reasons, but it's really for contraception. And so, again, you kind of come up with this word of fraud. I don't know what the actual definition of fraud is, but it's deceptive. The whole thing is deceptive. And that hurts me personally as an obstetrician gynecologist to see this profession that has swallowed these really deceptive practices, what I think are very deceptive practices.
So not only are you not treating the underlying condition that is causing your problems in the first place, you're just kind of masking it by taking the pill to regulate, but it's not solving the initial problem. But you're also being exposed to all the little side effects that you can't read in the packaging because it's so tiny.
Yeah, right. No, you're right.
Yeah, it's just...
no, but they're exposed to all of those side effects. Mm-hmm. And again, it gets back to something we said in an earlier edition of this program about how we look at populations of people now rather than individual people. And the doctor who wrote the paper who said, well, the incidence of this, the cancer goes up, but this cancer goes down, and overall it's negligible. But it's not negligible to the woman who gets the cancer. Or in the case of the young teenage girl, it's not negligible when she gets a blood clot in her leg and she has a stroke, or she has a blood clot going into her lung and a pulmonary embolus. That's real to her. And for us to take this sort of population-based approach rather than this individual person approach, to me it's just really bad medicine. It's a bad concept medically. There are important parts to medicine that you can look at from a population perspective. So I'm not writing it all off, but you have to look at the individual patient. The individual patient is a human person. And as a profession, I think we've gotten away from that.
Dr. Hilger's coming down and visiting the seminary in St. Louis. I'm just like, I felt personally that was incredibly degrading to women. If they've got all these problems going on, the thing is you should try to fix it. That's what medicine's all about. But not just cover them up. So good, proper medical science looks for the actual problems, the underlying causes, and attempts to right them. And praise God that we have Dr. Hilgers, especially here in Omaha, because he's one of the few scientists who's actually doing that in the area of women's health. We have the National Center for Women's Health not too far from here, and there, all of those problems he treats in a way in which is perfectly in line with the teachings of the church. and he actually goes and fixes the problems that occur. He doesn't cover them up like contraception does, but actually goes and actually fixes that. For those who aren't familiar, I don't know if I'm going to, there's another video in here, I'll put it online, but it's called the Creighton model of fertility care and also NAPRO technology. There's other forms of natural family planning, which are very good, but this one in particular is in a more holistic scientific framework that allows them to be able to address many of those other problems as part of it. So it's really a great scientific advance that we have, and really coming out of our own diocese here.
Gynecological health and fertility.
That standardization, along with the standardization of the teaching, developed into what is now called the Creighton Model Fertility Care System, which is, if I might put it simply, is a gynecologist's dream of a system. I mean, we're supposed to be experts in vaginal discharges. This is a system that guides you through all of that in a way that's easy, simple, reproducible. It has all the good concept of science behind it.
Development of the Creighton Model Fertility Care System proved to be a watershed event, one that led to a new women's health science called NAPRO technology. The surgical and medical practice of NAPRO technology offers highly effective treatments to a range of reproductive health issues, including infertility. The foundation of NAPRO technology depends on a thorough understanding of each woman's unique fertility cycle, something achieved through the Creighton Model Fertility Care System and its accurate and daily tracking of biomarkers.
See, the thing about what we're doing is that it comes down to a practical, everyday clinical reality. We can have a woman chart her cycles, but it isn't just the charting, it's the information we get back from that. And so you get back to an issue like infertility. Infertility really is a disease or a condition where the fertility system is not working right. But if you don't understand what fertility is, it's hard to fix it. It's hard to find out what's wrong with it.
With the guidance of a certified fertility care practitioner, Stephanie and Anthony began their first real search for answers to their infertility by charting using the Creighton Model Fertility Care System. Based on information from those charts, blood samples were taken from Stephanie on targeted days of her cycle and shipped to the National Reproductive Hormone Laboratory for analysis. Anthony's semen, acquired through a natural active intercourse, was also analyzed. With new valuable information now in hand, the Epaulites traveled to Omaha and the Pope Paul VI Institute for a series of medical and surgical procedures to diagnose and treat a number of conditions, including endometriosis, blocked fallopian tubes, and a low sperm count. 15 months later, Stephanie gave birth to a daughter, Claire Marie Epaulites. Today, the Epaulites are frequently called upon to recount their journey to parenthood and their experience with the kind of approach to infertility practiced at most fertility clinics today.
I thought that going to a fertility clinic meant seeing specialists, being diagnosed and treated, and being sent on your way. In retrospect, it is my firm belief that fertility clinics apply a cookie-cutter approach to solve problems, as in you, the patient, must fit into one of their approaches to treatment. We would eventually have to travel to Omaha, Nebraska to see a true fertility specialist, a man of compassion, a man of God.
Although Stephanie and Anthony realized their dream of having a child through the use of the Creighton Model Fertility Care System and NAPRO technology, there are no guarantees, but at the very least, couples taking part in this approach to human reproduction gain a far greater understanding of why they are not able to conceive. The Creighton model and NAPRO technology answers many questions, often overlooked or simply ignored. This helps couples accept their infertility and allows them to move on to other options like adoption.
Any questions in that area? Before we go. All right. Let's go to another fun one. Stem cells. Do we want embryonic stem cells or adult stem cells? Well, first we got to look at the difference. There's basically three types, as far as I know, Maybe there's more that I don't know about. But basically 3 types. The ones you hear the most about and the media plays up is the embryonic stem cells. And we know that the use of the embryonic stem cells is to kill the embryonic life that's contained there in the embryo, that human life. So that one destroys human life by its use. Then there's two other versions. You have the induced pluripotent stem cells, which are artificially made from regular adult cells in the laboratory, and then you have the adult stem cells, which everybody carries in their bodies in different places, that are normal functioning cells that are there. So the purpose of embryonic stem cells was to help the embryo grow and to become the human person that they're growing to be. Induced pluripotent stem cells, once they become a stem cell, well, they can become any kind of cell from them. And then the adult stem cells are naturally there for healing us. When they're used to try to treat problems, the first 2 have had thus far many bad side effects, tumors that form because they're basically cells that haven't been programmed for something specific. And so when they're placed in an environment in which they're not meant to be, they don't always function in a proper way. And if you look at it, the treatment history for the induced pluripotent cells are fairly, I think it's 2007. I have a slide coming up. I think maybe 2007 is when they created them. But so far, embryonic stem cells and the induced stem cells have no treatments, whereas adult stem cells have many. And I'll show you a list of some of them in a second here. First, here's an interesting story. Does anyone remember hearing about Geron Corporation last year? Well, Geron Corporation was basically the forerunner in embryonic stem cell research. And so they spent 10 years building up, talking about how miraculous these embryonic stem cells were going to be. And then finally, in October 2010, they were given permission to be able to begin using surplus embryos for their research. 1 year later, they stopped for what they said claimed to be financial reasons. Well, if you're doing a research that clearly doesn't have a short-term profitable gain, that it's not showing any results, you're obviously going to stop. So, I mean, that's a great thing for us to see, is that the forerunner in this research area had to stop because it just wasn't panning out. They didn't have it wasn't bringing up any cures, and if it's not bringing any cures, it's not bringing in any more money to do the research. So that big corporation had to basically stop. Here's an interesting story of Shinya Yamanaka, perhaps is his name. So he's the one who was able to create induced pluripotent stem cells. And the cool story about him is the reason why he came up with this is basically because he had been in embryonic stem cell research, but through his work, he came to understand that of the little difference there was between the embryos that he was working with and his own daughters. That, you know, there wasn't, the embryos would on their own would grow up to be daughters like his daughters. And so it led him to do other research. So even though his induced adult stem cells haven't panned out with any practical applications, I think it's important to note that, you know, the reason why he started looking into other things was because he realized the human life there that was contained within embryos.
If If there's ever any disease I do not want to get, it's scleroderma.
Sickle cell anemia.
Being a quadriplegic is very, very hard.
The doctor came and told us that Joseph may not live very long.
That I would never walk again.
I was preparing to die. Adult stem cells taken from my own body.
They brought the sample back and they just injected it.
Now I'm able to stand, I walk.
When my lung functions improved, that was a pretty exciting thing.
He just became actually a normal baby.
And it's a miracle.
I said, I know.
This can help so many people.
I'm gonna walk again.
Adult stem cells from my brother saved my life.
Adult stem cells saved my life.
It's very inspiring.
So, on one end, embryonic stem cells scientifically have shown no treatments have come out of that. There's some of the things adult stem cells have been doing. In some way, being used in areas around those diseases. And I personally can't tell you anything about what they've been doing in all of those because I'm not in the medical field.
No, I never use the word cure, but this is a paradigm shift in medicine. "14 years ago, we did our first patient, and then we just expanded to many different autoimmune disorders, and now we have many clinical trials for many autoimmune diseases.
I beelined it over to him, and I said, "I'm Amy Daniels, I have scleroderma, I'm enrolling in this other study, I want your help." And he took my hand and he said, "I can help you."
You do have your own stem cell compartment in your bone marrow that will regenerate that immune system.
They took my blood out and collected the stem cells, and then they gave me my stem cells back just like a blood transfusion. Almost immediately before I left the hospital, my skin started to soften.
That's one of the paradigm shifts. Treat one time, no medications. Whereas the standard throughout the world in the community is you're given a drug from a pharmaceutical company. Anything you do to get patients back to completely normal life, not using medications, the better. That's kind of a paradigm shift. One treatment be done, not continuous drugs.
I'm right back in there, right back in life again.
It's very gratifying. The patients are just very, very thankful to have an opportunity of regaining their life back.
I'm very optimistic. I think that we can use, stem cell therapy in a lot of diseases, and so I hope that we can continue to find therapies for more debilitating diseases.
If I was to have to go to a transplant or have a niece or something going through transplant, I would bring them to Northwestern to Dr. Burke. Because Dr. Burke digs. He digs to try to find out, well, what's going on with this patient?
In March of 2007, my boyfriend and I went to Chicago to meet with Dr. Burt for my 2-year follow-up. Again, test results were negative, factors were low. The transplant had worked.
And I am cured. He won't say it, but I will. Thank you.
When I first started this about 24, 25 years ago, I thought I'd have all the answers in 5 years. So it's a lot more work and a lot more time than you can imagine. This is just the beginning. There's so much more that'll come out of this. That's what happens when you open new doors. And for me, that's what life is about. It's opening new doors that in a way can make a small change in this world that helps people. And that's what I want to continue doing.
So, I think there again, when science follows the moral path and chooses not to go into this area and that destroys human life so as to attempt to help human life, that when it stays within the moral area, you can see the fruitfulness that comes out of it. So there's another example of when science follows what the church has always taught as the moral path, that's where the better science comes from. So, any questions in that area? I scared you away from asking questions because I told you I wasn't an expert. All right. So, in vitro fertilization and human embryonic stem cells. And the only thing that I'm going to focus on in this section is just the fate of those embryos that are now in existence.
In embryonic stem cell research, what makes the controversy so intense is that a nascent human being, that is an embryo at the 1-week stage, is being destroyed for its body parts, if you will, its stem cells. It is to use nascent human life as a corn crop ripe for the harvest.
Well, there probably is many definitions of human life as there are scientists. But one thing I'm absolutely convinced of is that an embryo in a dish is not a human life, and it's certainly not a person.
Well, I don't think that's a scientific statement. I think it is a human organismal life in the dish. And it's a common tool of rhetoric in political arguments to win by redefining the terms. I don't think either side should do that.
Well, the scientific definition of human life, I think within the context of what we're talking about is that human life begins at conception.
It's admittedly very tiny. It's admittedly in its earliest stages of development. And so the question is, does it have the moral worth that we assign to later stages of human development?
Fertility treatments are now so effective that the vast majority of time we have excess embryos. And the question is, what do we do with those embryos? Do we pick them up? Do we just throw them in the trash? Do we discard them? Or do we find something useful to do with them?
The issue isn't about leftover embryos. The issue is whether or not we can use human life instrumentally.
To those individuals who may have moral issues with human embryonic stem cell research, I would say, I would advise, I would plead education.
Some varying views from those different people, as you could tell. So that, yeah, the issue basically here is through in vitro fertilization, you've got all these extra embryos that are not used. So now, what do we do with them? Especially as we see them as Catholics, we know that they're human lives. So what do we do? So let's talk first of all, what is our situation? So through in vitro fertilization, we've got these frozen embryos, and there's, at the time when the source that I had, it said 11,000 in existence. I'm not sure there's more now than that, but at least 11,000 that are there unused. So the question becomes is, can these embryos be used for embryonic stem cell research? Is that something allowable? And in there, it's because even if you think they're a human person, they're going to die anyway. So can't we do that? Why can't we do it? So let's look at the science first. The first thing we should say is this a practical thing for, can human embryonic stem cell research even be upheld by the use of those excess in vitro fertilization embryos? So those in human embryonic stem cell research, their desire is they want to produce 100 million human embryonic stem cell lines, different DNA lines. But in order to do that, you have to have 100 million different embryos, basically, to match the 100 million patients that they want to be able to assist. So how many embryonic stem cells do we need? Going through and thinking about, well, how many of the embryos are practically usable, through our scientific techniques, how many are needed to be able to perfect so that you actually get a a usable line out of it. Well, if you look at it, if you're using new embryos, so ones that had just come into being, you would need at least 2.7 billion human embryos. But if you use the frozen in vitro fertilization embryos, since they went through the process of being frozen, some of them no longer become usable, and so actually you would have to have 4.1 billion frozen embryos from in vitro fertilization, which is not anywhere close to what we have now, right? Because I said that we only had 11,000. So it's clearly that's kind of a deceptive question for people to say, well, we've got them in existence, so we might as well use them for in vitro fertilization, or we might as well use them for this research. Well, you need a lot more than that in order to have your research get anywhere. So anyone arguing for that, it's going to be way inefficient. And cloning, making more and more embryos, new ones, is absolutely essential for human embryonic stem cell research to work at all. So even if they were to say, well, we're only going to use embryos that come from in vitro fertilization, well, it's not scientifically plausible or possible that it would produce any kind of fruitful results from that. So just from the purely scientific point of view, not even considering the moral point of view. So let's go to the morality side of it. Well, we know that the embryo is a human person, like the one scientist said. I mean, science basically shows that from conception, human person. So, leading from that, well, to produce the embryos for in vitro fertilization in the first place is gravely immoral. The Church teaches that. It's gravely immoral. It's not in accordance with the dignity of that new human life, and it's not in accordance with the dignity of the parents either. Secondly, to keep the embryos in that frozen state is gravely immoral, because once again, you're keeping this human person locked in this kind of perpetual state. So that's contrary to their dignity as a person as well. To cause their death by using them for research is gravely immoral. You can't do that. And to simply allow them just to die on their own is gravely immoral. You can't allow that to happen because of the dignity of that human person that's in existence. Can anybody think of any other options that are out there? What?
Not doing it, or with the ones they have. I understand there's women who do voluntarily carry the child.
Mm-hmm. And that also is gravely immoral because it doesn't uphold the dignity of the both the child to be born of the parent that they were conceived of, and it doesn't uphold the dignity of the mother either. So that is also gravely immoral. So, are there any other options? Mm-hmm.
Find out through research with animal frozen embryos how long they live in a frozen state, and then apply that same principle perhaps to the human.
But how does that help the human that's been frozen?
Oh, it doesn't. It allows them to basically exist until they naturally die.
But that's gravely immoral. That's what we said. Just to allow them, to keep them frozen is gravely immoral. So that's not a moral option. Any other? We're running out of options. We haven't found a moral one yet.
Well, I just have a question. If you only use enough and that you use them all yourself, like between a married couple, say they just fertilize 3 and then use all 3, is the church still against that?
That's still gravely immoral.
The whole thing?
That's still gravely immoral. Yeah, that's what I said. To produce embryos for in vitro fertilization, that whole process is gravely immoral.
Okay, so in any context.
In any context, in vitro fertilization, gravely immoral. So what basically you find is that first action. Yep, you got another option.
Question.
Mm-hmm.
Another option, but there are degrees of greatness, if you will. Okay, is there a way?
And which one is more grave?
Philosophically, to find which is
least grave?
The least moral option, or
The church has said nothing about whether or not, in this case, there exists degrees.
Is there a way philosophically or logically that could be determined?
I don't know, because many of these are based upon the same principles of the dignity of the human person. So what we're finding in this case is that one sinful action actually leads to a situation in which there is no moral solution. And that's what the church says. This is the document from the Congregation for the Doctrine of the Faith. Those embryos which are not transferred into the body of the mother and are called spare are exposed to an absurd fate with no possibility of their being offered safe means of survival which can be illicitly pursued. So there's 11,000 human lives in existence that there is no moral solution for us to react to. There is nothing that can be done. That's what the church says. And so the principle really is we see how sin leads to sin. You know, one sin of ours has placed us in a situation in which there is no way that we can't continue to sin. Mm-hmm.
But not to act
is a sin.
Is a sin. Okay,
yeah.
So
either to act or not to act is both a sin. And that's why I call it an absurd fate, because
so you're almost in a position of, if you are in a position that had to make a decision, or in a position that you could make a decision on, just say, one frozen or whatever the situation. Say it's frozen, then you found one embryo.
Mm-hmm.
Okay? No matter what you do, no matter what act or non-act that you do, you're saying you sin.
Yeah.
Gravely.
Yeah.
Therefore, it's almost like you're locked into loss of salvation. How do you repent?
You're not.
How do you repent from something you know you're going to do? I mean, how can you be sorry? How can I say I'm sorry for when I have, no matter what option I do, or the individual does, how can that person repent for an act or non-act that he has no option? Or she, I guess
there's no options. Well, I mean, it shows the seriousness of the situation, right? But we do know that there is no sin that God cannot forgive. Every sin, especially grave sin, God cannot say, He cannot say, go ahead and do it. But we do sin, and we do sin gravely. And so He calls us back to repentance. So, I mean, it shows the great, what comes out of this kind of, basically the principle that's being overstepped is the principle that God is the one who's the master and author of life. So we've made ourselves the master and author of life. So in a sense, we've done the same thing that Adam and Eve do, is thinking that we can determine good and evil. And by deciding we can determine that this thing is good, we've suddenly created a situation in which no good can come from it. So, yeah, it's definitely difficult. Mm-hmm.
What about, say, okay, I am very Catholic and infertile, and say, okay, I will give one of those 11,000 life.
Mm-hmm.
Yes, I'd still be carrying somebody else's baby. That still wouldn't be good, but wouldn't it give it a chance for life?
But it's still contrary to the dignity of that person. You know, it
so
seems.
What would you say?
How is it contrary?
How is it contrary? Because each human being is entitled to be able to come into the world in the way in which God intended them into the family, so that they come from their parents through an act of total self-giving between the two parents. Whereas through in vitro fertilization, it's this artificial act which does not occur through this total self-gift of the husband to the wife.
I get that, but
Mm-hmm.
given that it has happened what is our moral responsibility as a society to these 11,000 plus children?
It's difficult. The church has, this is as far as the church goes, is none of those options are moral.
Okay. Which leads me back to, if I don't act,
Yeah, it's not moral.
if no one acts,
Mm-hmm.
then that person is continuously sinning, right?
Yeah.
If that person is continuously sinning, I don't see the possibility of being saved, because my not doing anything is an act of an act of omission, if you will, or it's a sin of omission, and yet I can't do anything.
Yeah. Well, what I can't do is I can't say, well, since you're in a situation in which you're continually sinning, you can go ahead and do something immoral to get out of it. Well, I can't do that. I can't.
I can't even go to confession and confess that I repent of this sin, because in the very, while I'm even there,
though I wouldn't say that the people, like for example, couples that go and use this means, and so they're not going. Since their intention is not to continue to have human beings remain in existence in which they can know they're stripped of their human dignity, I wouldn't say they're culpable of that part of it. It doesn't remove the fact that it's something grave, but yet I think. But the church, once again, I can't say this because the church hasn't said more on this. At least I'm not aware of it. There's no sin that we can do that can't be forgiven. But just because there is no sin that can't be forgiven doesn't make all sin less grave than it is. So, but yeah, we're running into this tension that comes in when we decide the things that we can do and be in charge of things, when actually God's the one in charge. So we kind of need to. We'll go on to the next one. That's a lot of fun. But we'll go to the next one. This is even more fun. This is abortion case, and this is not abortion in general, but a specific one. Is it about the last one? Yeah, we're gonna go on. You can.
With her example, what's the difference between adoption?
Because the other child was born through that total self-gift of the parents to one another, rather than in an action that was supposed to be the total self-gift. Whether or not it actually was, is that doesn't even always occur necessarily even within marriage, So, but it was within the way in which God intends that the action to take place. So yeah, it's gravely, it's not a moral option to go about that way. And so you see kind of the whole concept of in vitro fertilization, because it leads to this kind of situation, it kind of emphasizes the reasons why it's not to be followed or not to be done. And the reason why it is because of infertility reasons, and once again, that can be solved in means that are moral, especially through the work of Dr. Hilders, for example. So we'll go on to this abortion case. This is a specific case in which we're going to talk about double effect. This is actually based upon a real case from Arizona. So you've got a young woman with pulmonary hypertension, and normally pulmonary hypertension isn't life-threatening, but in this case it's at a high level, and it's worsened because she's pregnant, and so there's a strain that causes this hypertension to increase to the point where one side of her heart fails, she goes into cardiogenic shock, and so both her and her child are in danger of death. And in normal instances, what they would do is they facilitate the delivery of the child so that the pregnancy would be ended, and so that would alleviate the thing. The problem here is that they don't know, in this form of hypertension, they don't know the cause of the problem. And so they can't address the cause. They can only do other things, but they can't address the specific cause. But the problem here is that it gets to this point, but the baby is not yet viable outside the womb. And so the question is, can D&C be done to remove the placenta? And by doing that, it brings about the death of the child, but it would save the mother. Yeah, so that's where double effect is going to, we'll try to apply double effect, because there's two effects there, right? This is good, right? Saving the mother is good, but the death of the child is bad. So the question is this a case in which double effect can be applied? If it can, then it could be done, but if it can't be applied, then it can't be done. So here are the 5 criteria before, and we'll apply those. First two, I want to apply it to the case of uterine cancer, because this can help us to understand our specific case of hypertension. So in the case of uterine cancer, the first criterion is to have the good act. So the good act is to remove cancer. That's something good, right? So to remove the diseased uterus is something good. And there's no other way to remove the fully cancer in this case. It spreads so much that the only way to do it is to remove the uterus. The woman is pregnant, and so there's a child there, and to remove the uterus would be to end the life of the child. So the will, you cannot will the death of that child, but you can only permit that, okay, if we remove this diseased uterus, it's going to cause the child's death. We know that's going to happen, but we're not willing it, but rather we're willing the life of the mother. We're not willing the death of the child. So in this case, the death of the child is not the means to the end. The means is the removal of the uterus, not the removal of the child. So it's not a means to the end. And then finally, there's a right order between the life of the mother and the death of the child. So the life of the mother is a great good. The life of the child is a great good. And so there's a just order between the two. And so it is moral in that case to remove the uterus to cause the death of the child. And here's an example of what follows from that is the reason why Saint Gianna is a saint is because she chose not to do that. Is that she had cancer, but she chose not to remove the uterus, but rather save the life of the child. And by doing that, caused her own death. And so that was a heroic thing for her to do. She wasn't morally obliged to do that. And so that's why she's now saint. Is because yeah, she knew that she would die from it. So she did the heroic choice. And so that's why, in that case, applied to uterine cancer, it's morally allowable to remove the cancerous uterus, even though it's going to cause the bad but yet not intended effect of the death of the child. All right. So that looks very similar to the kind of thing that we're dealing with now, but it's a little bit different. So in here, in this case, the action is the removal of the placenta and the child through the operation of called the D&C. But that operation in itself is not good, because you're removing something that's healthy, that's working perfectly fine. The pregnancy is not the problem, it's the hypertension. But the problem is they don't know the cause of the hypertension, so they're ending the pregnancy. So, and the second, the question is then, well, can the health of the mother be obtained in any other way? In most cases it can. This was a special case in which there wasn't any other way in which the health of the mother could be done. So in this case it seems like that one still applies. So see, the first one failed, the second one seems to not fail. Then next is the death of the child isn't willed. They don't want the child to die, but they want the mother to live. So that seems like it would hold. But then you get to the action itself. the means to bring about the good end, which is to save the life of the mother, the means itself is bad, because the means is the evil action of ending the life of the child. See, it's a little bit different from the one in the uterus. The means was the removal of the diseased uterus, not the ending of the life of the child. But in this case, the means is the removal of the placenta and the child in order to alleviate the symptoms that are being of the hypertension. So that one fails. And then finally, is there a right order between the intended life of the mother and the death of the child? There's a right order there, but the problem is that the death of the child is in one sense directly willed, because you're directly willing to do the action of the removal of the placenta and the child. So that one fails as well. So since those criterion fail, you cannot apply double effect in this case. It doesn't. So the removal of the placenta of the child was directly willed as the means to the good end, and thus was a direct abortion. And so in this case, that's how the bishop described it. Is what actually happened in the real case was that an abortion was performed, and the bishop responded saying, no, that was a directly willed abortion, and so it was thus an immoral action. So the difference between those two cases is that for the case of the uterine cancer, the harmful cause was known and it was directly addressed, whereas in the one with pulmonary hypertension, they didn't know the harmful cause, and so they addressed something else to try to alleviate it. But the something else they addressed, the way in which they were doing that, was an evil action in itself because it was a direct abortion of the child.
Variations. St. Gianna also applies double effect in that she wills the life of the child and permits the effect of her own death. So it can also be viewed the other way around. In this case here, is it possible for the child to survive if the mother dies?
No, because the child is not viable outside the womb at this point.
The mother wasn't going to die.
That's the question we need to know.
For what?
Would the mother have died if they did nothing?
Yes. Yes. In this case...
Would she have died before the child was born?
Yes. Yeah, in this case...
The child would have died also.
Yes.
So they're not achieving any good ends by not acting.
Yes, but remember from one of the first principles is that to achieve a good end, you cannot use an evil means. The end does not justify the means that are used. One cannot do that.
In this particular case, I just from knowing people from St. Joe's, they kind of talked about how they didn't know that if the pulmonary hypertension would actually have caused the mother's death, but assuming that it would have, I think that presents one of the worst complications in this scenario.
Yeah.
But ideally, what they could do is give medications that would reduce the pressure in the pulmonary arteries.
Yeah.
That would ultimately let the baby get to 24 weeks of viability, 26 weeks, so they could deliver the baby. But in this case, they thought that the mom was going to die before she could get that.
Yeah, and that's normally what would occur is they would use the medications to try to do that so that they could bring the child to term. But if we assume in this case that, yes, this was the only means to be able to save the life of the mother, then even in that case, it's not a moral option to do that.
Father, in addition to that, you don't know what the effects of the medication would be on the child. There's a good chance that at the age of this child that the medication would have affected the child.
I don't know about that.
That's
Yeah, I don't know about that. I don't know enough medicine to know that.
And one of the biggest unsaid thing, even though this did relieve the pulmonary, they didn't know at the time when they took that action that it would actually enhance her life. They thought they had pretty good, but they did not know for sure. So, I mean, they were wrong in so many ways.
Well, if it was true that that was the only means in order to save the mother's life, was to do the DNC and remove that, if that's the case, And maybe there's a question there whether or not our science was at the level of knowing that. If that was the case, then it seems that with the state of the understanding of our science, that there was no moral solution that would save their lives. Now that should grind on us a bit.
That is a big if.
Yeah, since I'm not a medical doctor, I'm placing it in the case that I trust that they tried to do as best as they could, to an extent. But the problem is that this should upset us, right? Should upset us that there was no moral solution and that could have been done to save their lives. If that was the only option and that option was immoral. So if there's a case in which there's only one option, and the option's immoral, well then there's no moral solution, right? So if that's true in this case, then there was no way in which both their lives could be saved. It should upset us, right? Has that ever happened in the history of the whole history of our knowledge of treating medical conditions in which we're unable to save someone's life? Yeah, it happens a lot of times. Happens all the time where our medicine is limited and that we're not able to save someone's lives. I mean, that happens every time someone dies of old age, right? We don't have medicine to be able to keep them alive. Remember the principle that we talked about at the beginning, that human life is a fundamental, but it's not an absolute good. So we can't use a morally evil means to preserve it, because the morally good thing is a greater good than the good of human life. And so, it should upset us that our science wasn't at the level to be able to do anything to save their lives, and that in order to follow proper morals, that if that was the case, that was the only thing to do, that it would cause both of their deaths. But we're stewards of this life. We're not, God's the master of the life. So if he places us in a kind of position where that happens, we have to remind us that we're not gods. As good as we may be with our science and our medicine, we're not God. And we may come into situations in which we're not able to have the solution that we would want to occur. So, it's one of the reasons why I present that is to make us think, to remind ourselves of the limitations that we have in science. Science can do great things. But, for example, a doctor shouldn't feel as though that they've totally failed when their science isn't to the point in which they're able to save someone.
Just a comment. I have an aunt who was in this situation that was going to have a child and was told she would die if she had the child. And her husband, she had lupus, and was told that it would kill her. Well, her husband had to make a choice, she and her husband, and he made the choice that he could not save her life, would go ahead and try to let the baby be born, because he knew this was a new life.
Mm-hmm.
And so he could not do an abortion.
Yeah.
So she lived, the child lived in my cousin now.
Yeah.
And so, sometimes we discount God's hand in that. I mean, that is a situation where, we try to do our best, but that they made a moral decision.
Yeah.
And God was the master in that
Yeah,
situation.
based
He
upon-
decided that they both should live. And she is now, my aunt is now 80. She's 80, she still has lupus, 30 years of lupus, and had cancer, and is now cancer-free for 8 years. And it's just a situation, and her husband has been a deacon in the Catholic Church for 30 years. I mean, it's just a life of faith they live.
Yeah, when we trust God and we...
Sometimes we try to moralize everything, and we just have to try to make that decision best we can, and God honors it.
Yeah, based upon those principles that we receive from him, we make that decision through the conscience. So, all right. We're already over time. So, I don't know. For a show of hands, do you desire to go into this section on the end of life, or do you want to leave? Maybe. Well, if you have to go, you may go. But for those who desire to go into this, we'll continue. All right. So the final one is kind of on end-of-life things. And the first point that I think is important to make is kind of a mentality that kind of comes through, whether it be through our medical society or basically through our culture in general, is our attitude towards suffering and death. And I don't think any of us are immune to that. I know I'm not. That we feel as though suffering and death is not something that should be avoided at all costs. That we want to stay away from suffering as the greatest good is to remove all suffering from us, to prevent that from happening. And of course, it's never going to happen. Anybody who lives in this world is going to suffer in some way. But the meaning of suffering has been lost in some way. And an important thing to keep in mind in this case is to remember that what the church teaches about the redemptive value of suffering. And because of what we just went through this past week, of Christ's suffering and death, that it has new meaning. A new life comes out of it. So the suffering that we go through during our lifetime, and it's not something that has to be avoided at all costs. We, of course, it's fine to want to avoid suffering and not want to go through pain, but yet it's going to come. And to realize that when it does come, that there's a meaning there that comes through, especially united with Christ. And I think Pope John Paul II is a great witness to that, not just in the things that he said, but in the way that he lived, himself going through great suffering throughout his entire life, all the way up until the end of his life, of enduring great suffering, but bringing that redemptive value, that the salvation that comes to us out of suffering and being able to suffer for others as a prayer. So I think that's an important thing to keep in mind. When we're talking about end of life, one thing, here's a definition on what euthanasia is. Of course, the church has always been against euthanasia, which is an action or omission that by itself or by intention causes death in order that suffering may in this way be eliminated. And I think I heard on the radio today that, I don't remember, some state is trying to, there's a petition going around for a vote to try to get it to be legalized there as well. So it's a very prevalent thing. So you see, the reason for it is to get rid of that suffering. We don't want suffering at all. So we got to get rid of it. And so the best way to get rid of it is just to hurry up and cause death to happen, because suffering's got to be avoided at all costs. Once again, one is becoming the master of life and death, rather than being the steward of life and death, rather than drawing the meaning of what human life is from Christ, but trying to make the meaning for oneself. Let's see. I'm going to skip that. Okay, so in the area of the end-of-life issues, the terms that are important to understand are ordinary means and extraordinary means. And these are terms that come through from the church. So these deal with the kind of treatments and stuff that can be done toward the end of life, or actually at any moment. So ordinary means are all medicines, treatments, operations which offer a reasonable hope of benefit and which can be obtained and used without excessive expense, pain, or other inconvenience. It's really easy to interpret, right? I wish it were more easy to interpret too. But so basically, if you've got something that gives you a reasonable hope for benefiting the person, and it's not excessive, and that's can be a difficult part to interpret exactly. It has to be interpreted case by case in specific cases. It's hard to do in general. Then it's ordinary means, and so you're obliged to follow it, because we have the obligation to preserve our life, which is a great good. Extraordinary means is the opposite. All medicines, treatments, and operations which cannot be obtained or used without excessive expense, pain, or other inconvenience, or which, if used, would not offer a reasonable hope of benefit. So, in a specific case, it may be that a certain treatment doesn't bring that benefit, or it is overly burdensome. It does it in expense or other means, and so it would not be. You would not be required to follow those means. That's called proportionate or disproportionate means, or another term for it. But you can see that depending upon the specific case that someone's in, certain things could move from one side to the other. So, once again, the principle that we learned before is that human life is a fundamental but not an absolute good, right? So, we can morally forego extraordinary means. So choose not to use those extraordinary means. If it's done, so it says, when death is coming, it's permitted to refuse certain forms of treatment that would be burdensome, prolonging life, that would not bring this kind of proportionate long-term benefit for them. But that's contrasted by euthanasia by omission, which would be removing means that are ordinary. So if you're removing means that are ordinary, remember those are things that wouldn't be burdensome, that they do give a benefit in sustaining life. So we can morally forego extraordinary means, but we can't remove ordinary means, especially so as to relieve suffering, to totally get away from suffering. This quote, we don't have to read it all, but this basically says that these definitions, as you can see, are not, there's gray areas, right? It's difficult to interpret. You got to interpret it within the specific cases. And as a scientist, my background myself, I wish it was more kind of objective, because this is hard. This is not easy to interpret that in specific cases. So it takes a lot of prayer and discernment when you're faced with decisions in that area. But these kind of questions can help you remember the principles. Well, God's the master of life. So my desire to do this in this act, if I'm going to continue to keep this person alive, or if I'm going to cease to give them certain care, am I taking over God's role as being the master of life? Or am I truly being a steward of life instead? Am I upholding the dignity of that person, image and likeness? I remember people have dignity even in suffering. Suffering doesn't destroy their dignity, just as it wouldn't have destroyed Christ's dignity to suffer. And then remember, human life is a fundamental but not absolute good, so we're not required every extraordinary means to keep someone alive, and recognize that there's this value of suffering. In fact, a new thing that's come out in the diocese, and I've got some brochures if you want to pick it up, it's an apostolate for suffering. And actually, some of the most important people in our church are those people who all they can do is suffer for us. Because that's where the greatest transformation, the greatest love comes out of, was when Christ could do nothing but suffer for us. And so, our view in society is that those people who are suffering, their quality of life, a lot of times you hear quality of life arguments, their quality of life is so bad that we've just got to end their life so that we alleviate that kind of suffering, that bad quality of life. But the church says no, that their role in suffering is incredibly important. And this brochure specifically comes out through the vocations office. And it's the apostolate for suffering is so that people use their suffering for the prayer for vocations. So I've got a bunch of these up here if you want one. Yes, he has a beautiful, in fact, one of my classmates in the seminary wrote his master's thesis on, the document is Salvifici Dolores, on redemptive suffering. It's a beautiful document written by Pope John Paul II. And that's something beautiful that we have as Catholics, is the understanding of the redemptive value of suffering. And so we need to bring it into this area. And I try to do that when I go visit people in there, remind them of how the suffering they're going through is uniting them to Christ, and that they're actually, Christ is even closer now that they're doing this, and their life is great, still has great meaning, even if they're not able to go out and about and do the kind of active things that they may have been able to do before. So that's an important thing to keep in mind when you're trying to make those kind of decisions, when those come up in your family. A specific case in this is when we're dealing with persistent unconsciousness. The persistent vegetative state, or is also referred to as permanent vegetative state, which is actually an unfortunate term because that goes kind of beyond what science knows. It doesn't really know that it's permanent. In fact, there's been many cases in which it hasn't been permanent, so we really shouldn't use that term. So the first term, it comes from back in 1972. It's basically a state in which someone is in unconsciousness, characterized by sleep-wake cycles, so like eye movement, and it's different from what a coma is. A coma is basically very short-term. Either the person comes out of the coma or they advance onto death quickly. So it's a different thing from what a coma is. So not everybody. So the cases of comas are not the same thing as vegetative state. So here's kind of a definition from Pope John Paul II in 2004 of what this condition PVS is. So there's no evident sign of self-awareness or awareness of the environment, and it seems and they seem unable to interact with others. But to say fully that they can't at all, we don't know that. They just don't interact in the ways in which normally we perceive that. Leading up to kind of the medical society's understanding of persistent vegetative state, in 1994 there was this task force that basically became the final word of how to deal with people in this state. And for them, they classified, I think the important thing to know is that they classified assisted food and fluids as medical treatment. And by doing that, it basically became, well, that means it's optional. It can be, we feel as though it can be removed. So it could be refused. So a person in the persistent vegetative state, according to this, since 1994, it's kind of mainstream medical community, as I understand it, that it can be refused or removed. Though the law doesn't necessarily line up with that, because that kind of got into the whole Terry Scheibel thing of whether it was lawful or not to do that. And it also comes in conflict with what the church eventually will conclude about assisted nutrition and hydration. So this was in 1994, but if you look on what was happening within the church at that time, we're a little bit slower we want more time to think about these things, to make a decision. So it wasn't until 2004 when John Paul II had a papal allocution in which he was very clear as to the church's position, though some people tried to interpret it in other ways. And then it was reiterated in 2007 as to exactly how we're to treat people that are in these persistent vegetative states. So it's going to be that the church is not going to end up following the medical community when it comes to food and fluids for those in persistent vegetative states. So in the background behind all this is the whole history of Terry Scheibel and the things that she was going through. So you see, when she came up, it was already decided by the medical community that this was fine. But according to law, it wasn't, and according to the church, it hadn't been anything officially said until here. It's finally when we officially get word from Pope John Paul II. And of course, it's unfortunate how that turned out. So looking at the science of that, well, the science can't prove that state is permanent in any individual patient. In fact, there's been cases in which people that they thought were in that state have come out, and if not fully to a life, but they're realized that no, they weren't to the point basically that they thought they would. And then they can't. Part of that is they can't prove that their inner awareness is not there either.
Can you reiterate the church's position? I'm not sure I understood that.
Yeah, I'll get to it.
Okay.
Yeah, I haven't explained it yet.
All right, that's what I didn't know.
Good. I haven't explained it yet. I was alluding to that it was different from the medical communities, but I'll show you very, very clearly what the church teaches. So this, from the scientific point of view, here's the limitations. So the science can't say that, and also it can't prove that. Like, one thing they'll say, well, we remove the nutrition and hydration so that they don't have to suffer anymore. But actually, it's been shown that they suffer. That it seems like they suffer more when it is removed, because they're not really in a state. When you apply the ordinary and extraordinary means, ordinary means gives a reasonable hope of benefit over the long period of time. Well, the giving them nutrition and hydration does, because I mean they're not in a state. Those people in a state of dying can't even take in the nutrition and hydration. Like, it doesn't help them. So that's why it's perfectly allowable when a person gets to that point in the dying process in which their bodies can't absorb that anymore to choose not to do that, because those would now be extraordinary means, and it actually could add to greater discomfort for that person. Whereas in this case of the persistent vegetative state, that the person actually does benefit from the use of nutrition, assisted nutrition and hydration. They're not in the same way. They're not in that same state of dying. So people basically, most people believe that the church wasn't going to make a more precise definition because the science wasn't very precise yet. But part of the difference is that the medical community determined that nutrition and hydration was now defined as a medical medical treatment, whereas the church wouldn't see that as being a medical treatment. That in most cases it's ordinary, but not always is it ordinary in those cases where it's no longer able for the person. So this now will be your answer to your question of what exactly does the church say then. So these are two questions that were addressed to the congregation for the doctrine of the faith. And so the first one is the administration of food and water, naturally or artificially, morally obligatory, except when they can't be assimilated by the patient's body? Is it morally obligatory? So, is it obligatory to give people in PVS food and water? And then the second question is, when that food and water is being supplied by an artificial means to someone in this state, can they be discontinued? Can you remove them when they judge that there's no way that they're going to be able to recover their consciousness? So here are the answers. First one, yes. The administration of food and water is ordinary and proportionate means of preserving their life. So, which means they're obligatory to be given that hydration and nourishment to them. That way, and it says, in this way, suffering and death by starvation and dehydration are prevented. You're being a good steward of the life. I mean, it may not be the life that we would want, but it still has value because of the value of redemptive suffering. The second one, can you be removed? And the answer is no. A patient in that state is a person with a fundamental human dignity and thus therefore receive ordinary and proportionate care, which includes, in principle, the administration of water and food, even by artificial means. So you can't really get clearer than that as to the... But the thing is that for the majority of cases are not, especially those toward the end of life, they're not in the state of PVS. They're not in the persistent vegetative state. There's many more people that are not in that state than there are in this state. But this helps to clear up those cases in which it is. So like for Terry Schiavo. That's why we now see, because of this, that was an unfortunate event that happened. All right. So to kind of conclude those things, I mentioned how we were going to look at how the church actually supports the moral teaching, or the science supports the moral teaching. So there, for example, behavior change programs work, whereas condoms aren't shown to work. Napper technology, the Pope Paul VI Institute, treats the conditions, whereas contraceptives only mask the underlying problems. And then adult stem cells bring about many treatments, whereas embryonic stem cells haven't produced anything yet. The second one, moral problems occur when science refuses to admit its own limitations. So therefore, in the cases of IVF, it leads to that observed fate of the embryos. Abortion not being not acceptable just because science doesn't see another option. And that suffering is not meaningless, but it has a redemptive quality to it. And just to finish, from the first time that we met way back in October, if you were there for that, and you've trooped along the whole time, faith and science come together at a crossroads. And the place faith and science, or nature and spirit, meet together at a crossroads, and that's the human person. So that's this area of medical ethics that we're talking about today is really where it becomes the most personal of all the sessions that they did. These are the ones that really affect our eternal salvation the most, because some of us may have to come across and make difficult decisions in some of these areas. But know that Christ is there with us. He's the model of what it is to be a human person. So that's why we turn to him to be able to help understand how it is that we're to act. And to finish, remember that things that we receive through faith and through reason, through faith and science, they work together to lift us up to the truth that God gives us. And those scientists, whether they be in the medical field, in physics, in biology, wherever they are, that if they strive to, in humility, understand the world around them, understand the human person, then they're being led by the hand of God into understanding the truths of the creation that he made.